Hi there. My name is Bob Hiatt. I'm the professor of epidemiology and biostatistics at UCSF and also the associate director of the Cancer Center there. But my role in the Upstream project is as a co-investigator from UCSF, which I've enjoyed doing very much. This this conversation with Dr. Sor Piawah is about the pilot projects that we sponsor. And she's one of the awardees of a pilot project, and we'd like to share her experience with others for the purpose of demystifying the process and encouraging others to apply. So, Sor, I'm glad you were able to join and do this, and I'm so happy that you applied for this project and are moving right along. Why don't you tell us about your project? Tell us what it's about and what you hope will the outcomes be.
Yeah, thanks for inviting me to chat with you today. So my project really stemmed from an interest in improving the diet and lifestyle of cancer survivors, but specifically looking at the nutritional status of cancer survivors and addressing some of the needs of patients facing disparities in access to healthy foods or access to education around healthy foods. So my upstream project was a proof of concept pilot study to examine the feasibility of an intervention to address nutrition insecurity using grocery vouchers plus education and navigation. Um, and it was an interesting project because we were able to partner with Instacart as well as other investigators at UCSF and Stanford, and were able to provide participants in the study with weekly vouchers that could be used to purchase healthy foods that met criteria for cancer survivorship recommendations. Um, we opened the study in the spring, and actually within a month, we were able to successfully recruit um, to our goal of 40 participants. And what I can share is that the feedback was really positive, lots of interest in programs like this. And we're going to present more full results in the fall, in the coming months at the Society for Integrative Oncology conference and other conferences.
So, Sora, people don't know it maybe, but you're a practicing medical oncologist. And what motivated you to do something like this, which is sort of out of the normal track that medical oncologists practice?
Yeah, I think as a medical oncologist, a lot of my time is spent counseling on chemotherapy or other cancer therapies and working through toxicities. But I also have, times where I have patients who are done with all of those treatments and are in the middle of treatment and looking for ways to support themselves beyond just the cancer-directed therapies. And nutrition is probably one of the most important things that we can do during and after a cancer diagnosis. And I have an interest in disparities in cancer in general, and was most interested in trying to bridge that gap in terms of access to nutrition for our most underserved patients.
So, as a clinician, what can you say about your experience working with community?
As a clinician working with
Well, I
community,
mean, it's not normally something that clinicians worry about or talk about very much. So, tell us
yeah.
about that.
Yeah, it's not something that in day to day we necessarily, I'd say we think about it because we rely on community partners and community in general to disseminate or to reinforce our recommendations. And um, as a clinician, I think community matters to support our patients during and after treatment. Working with navigators and other community present individuals I've seen that help. Certainly when I was at San Francisco General, I've seen that help patients follow treatment recommendations. I've seen that help improve quality of life and just ability to tolerate the long journey that is cancer treatment.
So thank you for that. That was very clear. And the interesting thing is about this Upstream Center project that we're all involved in is that we are trying to go, quote unquote, upstream to look at the drivers of the social drivers of health and cancer in particular. So thinking about food insecurity and food is one of the major aspects of our environment that can really influence not only cancer but many other factors. So that experience is great, and it's so great that you've had that orientation. What do you think the most interesting results are that you've had so far?
It was, it's a pilot study, so I think really we were just testing whether it would be feasible to recruit patients to a study like this. And I don't think it was surprising, but it was interesting, the uptake and just the positive response to having these grocery vouchers, even though they restricted the types of foods that could be purchased. I think the other interesting thing is just the kind of ability to work with Instacart. I think that was new for all of us, kind of partnering with a bigger organization like that and curating the program to our study
Mhm.
was a new skill to develop, but one that I think now that we have can help kind of future larger scale studies.
So we're getting ready to have a new round of pilot studies due in November. The application's due in November. What would be your advice to prospective applicants? I know it wasn't all easy for you. There were some bumps in the road. So any advice about how to apply and what kinds of things to expect?
Yeah, I think that definitely apply. I think the funding, I'll say it's being able to complete this pilot, it's really formed the foundation for, we already have a planning grant out for kind of a bigger study building on it. So I think that this mechanism was really, really helpful in kind of giving us that lift we needed to at least test the idea. So I think if there's an innovative idea that's kind of looking at community and looking to just pilot new ideas, I think definitely apply. Um, Ideally, having this, I think one of our roadblocks was the time it takes to get approval, kind of regulatory approval, especially for, as I mentioned, this was innovative because of its partnership with a larger company. So kind of taking that into account as you apply and you prep the regulatory approval process. But overall, it worked out. I think the study, it's a 4-week intervention. And once we had everything done in terms of regulation, we had our team assembled. And I think one of the things we did was in the background, we had all of the recruitment flyers, the surveys, the red cap build, and everything related to the project was ready to go, such that once the regulatory approval came, we could recruit and enroll pretty quickly.
Did you have any issues with the Institutional Review Board, the IRB?
I think we didn't have any issues with the IRB in particular. The issues we came across were more contract level, so negotiating the contracts between not just UCSF and Instacart, but Instacart and Stanford, and then Stanford and UCSF. So
Mhm.
I think remembering that kind of when
Yeah.
there are 3 institutions involved, it just takes 3 times as long.
Yeah, thank you for saying that. So
Yeah.
people that are looking at this clip should realize that the Upstream Center is a collaboration between UCSF, Stanford, and UC Davis.
Yeah.
And Stanford's the primary.
Yeah.
So we need to find ways to more efficiently work together to make this happen. It's
Yeah.
great from a collaborative standpoint, but sometimes the tactical issues get in the way, or slow things down a little bit. So I
Yeah.
think people should be aware of that.
Yeah.
Is there anything else, about the Sor, about the project you'd like to share?
No, I think you'll probably see a lot more studies like this. I think especially within oncology, there's a precedent for kind of food as medicine interventions in kind of diabetes and other metabolic disorders, but a little bit less in the world of oncology. And I think what we wanted to do with this study is show that we can recruit, patients who've had cancer from diverse backgrounds, and that there's a need for this type of work. And I think in the future, there's a lot of interest in building this out and trying to formalize programs like this.
How did you organize your recruitment strategies?
That was, we were lucky to have access to patients who had participated in other survivorship studies. So that was one source, and had expressed interest in future studies. And then Aaron Van Blergen, the principal investigator, has knows how to use MyChart recruitment really well. So kind of she's used that with other lifestyle studies and kind of sending out recruitment messages to patients via MyChart. So we got some that way. And then our partnership with Stanford and kind of working with their community advisory board also yielded some connections as well.
Great. Well, I think those are the main points I wanted to cover. So thank you very much for joining me for this conversation.
Thank you. It's good to see you.
Yes.